Our patient is having a synovial biopsy today. He arrives at the clinical research facility. The synovium is the name for the tissue which lines the inside of a joint. A synovial biopsy is a way of collecting a small sample of this tissue. In conditions like rheumatoid arthritis, this lining of the joints can become inflamed and painful. Doctors can analyse the tissue sample to learn a lot about what is causing this inflammation and which treatments may be most effective. Synovial biopsies are sometimes done as part of research studies to increase our understanding of rheumatoid arthritis and other similar conditions. In the future, a synovial biopsy may become part of routine care for some patients. Our patient was able to eat and drink normally before the procedure, and he expects the whole visit to last no more than 2 to 3 hours.
As you know, what we're here to do is to really have a think about what's causing the arthritis that you've got. And part of that is it'd be really helpful for us to get a biopsy, in particular for some of the research we're doing here at Newcastle.
No problem about that.
So what I want to do first of all is to check that you've received an information
The doctor takes time to fully explain the biopsy procedure and answer any questions.
You've had a chance to read through.
Yes.
Were there any questions?
As with any procedure, the doctor explains that there is a small risk of complications. This could be some simple bruising over the joint to more serious things like an infection. Serious problems are extremely rare and happen to only perhaps one person in 1,000. The doctor must be sure the patient understands the procedure and is happy to go ahead. They then both sign a consent form.
It's for us to take a biopsy. You're confirming that you've read and understood this information sheet.
Yes.
You understand that your participation is voluntary. You can withdraw at any time, and it won't affect how we look after you. Signature there.
When I woke up at 6:30 this morning, I wasn't sure. I didn't know what to expect. But since I've been here, I feel absolutely terrific.
The clinical research facility has a procedure room for biopsies and minor surgery. This is to make absolutely sure that the biopsy is done in a clean and safe manner. The nurse escorts the patient to the procedure room and helps him to get comfortable on the bed. The nurse checks and records the patient's blood pressure and pulse. To minimise any risk of infection, the skin over the joint is cleaned with antiseptic. The doctor uses the ultrasound scanner to see an image on screen of the inside of the joint. The patient is awake throughout the biopsy, chatting to the staff. To minimise any pain, the doctor injects local anesthetic into the skin over the joint.
You'll start to hear a noise like this. Okay?
Yeah.
That's just the biopsy needle taking some samples. All right?
The doctor places the special biopsy needle into the joint.
Okay, very good. There we are.
He uses the ultrasound scanner to check that the needle is in the right place. When he pushes a lever, a small sample of tissue is collected at the tip of the needle. He then removes the needle and places the sample in a container. He may repeat this a few times. When the needle is removed for the last time, the doctor presses gauze on the tiny puncture hole for a few minutes to ensure any bleeding has stopped, then applies a small dressing.
The only thing I ever felt was the first little prick. After that,
With the local anaesthetic, was that? Yeah.
And
No, that's what I always tell people.
there was no feeling of any pain or anything like that. It was just a click, like you're snapping the scissors shut, and that's as simple as what it was, I should imagine. But it's fantastic.
The staff will monitor the patient for up to an hour to make sure he is fine and there is no further bleeding from the small cut.
Can I have a look at that dressing?
The patient should look out for signs of infections, the joint becoming red, hot or swollen. He may also feel unwell with flu-like symptoms. The nurse reassures the patient that infections are rare, but he must contact the department immediately if he notices any of these symptoms. If this happens overnight or during the weekend, he should contact his GP's out-of-hours service or go to an accident and emergency department. The joint can sometimes feel a little achy for 24 hours following the biopsy, after the effects of the local anesthetic wear off. The nurse will usually advise the patient that he can take painkillers such as paracetamol for this. The nurse advises the patient not to overuse the joint for the remainder of the day and to avoid lifting any heavy objects such as kettles or pans.
No washing up today.
No washing up. No getting that dressing wet. So keep it dry.
The patient can now go home.